The broadcast is now starting. All attendees are in listen-only mode.
Good evening, everyone. This is Coach Reem Jishi, and I'm going to present tonight about injuries. Before I get started, I just want to check the technology. Can someone just type into the question box if you can hear me and if you can also see my screen? Awesome. Thanks very much. The first webinar I did a couple years ago, I had to do it 3 times because I wasn't showing my screen right. So I appreciate it, and we will get going today. So this webinar is being recorded, and you can view it later. It'll be posted later in the member area. And just if you have any questions along the way, please go ahead and type them into the question box. And sorry, are you hearing me or no? I have mixed response back here. Okay. All right, I think we're good. If you have any problems along the way, though, please type them in if you lose me. So, okay, so first, before I get started, I'm just going to tell you a little bit about me and my background and what I am and what I am not. So I'm a coach with OutRival Racing and also the Run Formula. I'm also a certified personal trainer through American College of Sports Medicine. I've been doing both of those for about 10 years. I'm certified in TRX and also functional movement screen. What I am not a doctor. I am not a physical therapist. I'm not a chiropractor. So my goal today, if we come out of it with one thing, it's to get you to listen to your body. And when your body speaks, it is trying to tell you something. So pay heed. And just to try to give you enough information that you have some understanding of what some of the signs and symptoms can mean. It doesn't in any way take away from the need to seek skilled medical help when you're injured. Okay, so 5 training cornerstones. We have the 5, the training, nutrition, rest, event, fueling, pacing, and mental training and mission. So our focus today, when we talk about injuries, it's going to hit the first 2 points, training as well as nutrition and rest. So key points for today's webinar, we're going to talk about the difference between soreness or injury and like the good pain and the bad pain. Some common training injuries, the causes of injuries, and prevention of injuries. And we're going to talk about those together because they're basically the 2 sides to the same coin. And then treatment and the road back. So as endurance athletes, most of our injuries are due at least in part to training mistakes. Going too fast, too soon, too often. So the good news is that the risk and severity of many of our injuries can be decreased by smarter training, by listening to your body. And key takeaway message for today, when your body says stop, listen. Listen to your body. Okay, so the first point, soreness versus injury. It's normal to have aches, some stiffness, soreness, muscles burning a little bit. That's where training. We're putting in a lot of hours a week. Our muscles are going to be sore. And sometimes we're a little creaky, but what you need to look out for, the red flags, pain. On a scale of 1 to 10, if it's greater than a 3, you should stop and evaluate. So that's a tough one because our pain thresholds are different. I definitely have some athletes who can withstand a great amount of pain and just keep on pushing through, and others that their pain scale, a 10 is, what someone else might call a 5. So the big one I look at is the second one, which is changes in your typical movement patterns. So if you are walking along and you're limping, chances are you are injured. If you have to adjust anything in how you're moving, how you're running, how you're swimming, because something hurts, then you're injured. So another sign is a constant no ebb and flow pattern. So you're feeling the pain all the time. It's localized. It stays in one spot. So I always said, long before I was coaching, I said, well, if my pain is moving around my body, then I'm not really worried about it. It's when it gets stuck in one place. And that's definitely stuck with me over time. So So if one day it's your elbow and the next day it's your shoulder and the next day it's your knee, maybe not so worried about it. But if it gets stuck in one place, and that's where you start focusing. So other signs immediate, like a sharp shooting, stabbing pain, or it persists even after true rest and first line treatment. So if you're experiencing some pain in your knee, you rest for 5 to 7 days and it's still painful, then chances are it's an injury that needs to seek further attention. If you have to take pain medications to train, then chances are it's an injury. If it resolves with rest but flares back up when training resumes, then that's something you need to look at. Like a stress fracture will feel better if you're not moving very much, but as soon as you start moving, then you end up having some pain from it. So serious injuries, they do not happen overnight. There's usually a point in time where you can make a change to the trajectory of the injury. So some common training injuries, and we're going to go through each of these. A lot of these are soft tissue injuries. There's really in here just one bone injury, which is a stress fracture. So we're going to just take them one at a time. So as I'm going through these, if you do have any questions, please go ahead and type them into the questions box. So the first one that I want to hit is medial tibial stress syndrome. And this is an overuse injury, a repetitive stress injury in the shin area. It's commonly known as shin splints. So you see it often in new runners. It's a really common complaint for people who are just starting to run. You also see it in athletes who've recently intensified or changed their routines. So basically what happens is that as you increase the activity or bring on new activity, then it overworks your muscles, tendons, and bone tissue. They're not prepared to take on that activity. And the symptoms, so you end up with pain along your shin area. So you have pain, you might have tenderness, soreness, some mild swelling in your lower leg. So overuse injury primarily is what it is. There are some compounding factors like shoes, and we'll spend some time talking about shoes. Comes up pretty regularly in one of the causes for injury. And so if the shoes don't have enough stability, if they're older shoes, if they're just not the right shoes for your feet. So running mechanics, if you're putting too much stress, like if you're running with really bent knees as you land, then you'll put more stress on your lower leg. If you have flat feet, that's another compounding factor you can deal with the right shoes can make a big difference there. And then weakness in your cores, hips and core muscles. So the stronger your muscles are, the more they're going to be able to take the pounding, the repetitive pounding. So that is usually an injury that comes on at the beginning, but with proper rest, ice, anti-inflammatories, if you need them, then shin splints do tend to resolve themselves. And so you'll see in a lot of these that the cause of the injury is overuse. And the compounding factors often include shoes and include weak muscles, particularly your core area muscles, and that the initial treatment is often very much the same: rest, ice, and some Advil. And then in addition to that, stretching and strength training. So the next one, stress fracture. So this is an actual stress fracture. It is an actual fracture of the bone, but rather than it being caused by like an immediate hit to the bone, it's something that happens just a little bit over time, tiny little cracks. And after a while, the bone just can't take it anymore and you see a fracture. A lot of the time, you won't see it on an x-ray until it's healed. But it's one of those that you usually know you have a stress fracture because it hurts a lot when it happens. And then if you rest it enough, you don't really feel much pain, but as soon as you start putting any pressure on it again, it starts hurting. So it basically happens. So stress fractures tend to happen when the muscles around your bones are just getting tired. They've taken too much, they can't take any more, and they just give up. And so the bone starts absorbing more of the pressure, and then it results in the break. So it often happens if we're increasing the amount or intensity of an activity too quickly. It's seen like many injuries commonly seen in runners. Some compounding factors are if you're female. and tend to be a lighter female. You see often weak muscles, shoes that don't have enough stability in them or are worn out, or causing your foot to land in a way that you don't want it to land. Weakened bones, so if you have osteoporosis or osteopenia, poor nutrition, alcohol, smoking, and a big risk factor is a previous stress fracture. So there are some things in there that you can change and some things that you can't, but those are other factors that make it more likely for you to have a stress fracture. It can occur anywhere, but it's mostly commonly seen in the weight-bearing bones of the lower leg, so in the tibia or the fibula, and also in the foot and the metatarsal bones. And those are the long, skinny bones on the top of your foot. So symptoms can include tenderness at a specific spot and less pain with rest. And so the initial treatment on a stress fracture is rest, rest, and more rest. There's honestly not a lot you can do with most stress fractures other than just ride it out and not run on them, which has the impact. There are options at some point to be able to go back to other exercises like pool running. Cycling can be okay depending on the place of the stress fracture, but that's something that a stress fracture is something that you will see a doctor for, and that you need to follow the physician's advice on that. So next one, how many of you out there have had plantar fasciitis? Very common injury. So the plantar fascia is a thick band of tissue that connects the heel bone to the toe. So basically the arch of your foot. The inflammation causes pain and stiffness. You might feel it in your heel. You might feel it in the arch of your foot. It is often the worst right when you wake up in the morning or after you've been sitting for a long time. And it tends to feel better once you get moving. But then once you stop moving or you're spending a lot of time on your feet, then the pain will come back. So some additional risk factors, some again you can change, some you can't. If you're female, if you're 40 to 60 years old, shoes is a place that you can change. If you're carrying more weight than you ideally should be carrying, that's going to also have an adverse potential impact there. Flat feet or high arches, tight Achilles, and sometimes an unusual walk or foot position will also lead to it. So instead of going straight forward, if your toes are pointing in or out, high heels, or you spend a lot of time standing. So those are some risk factors. Initial treatment, the same basic ones, and also once this is something that you'll probably end up at a physical therapist with, and they'll probably advise some rolling of your feet and some stretching out and some exercises, picking up socks with your feet. But that's something that mild cases, if you stop and rest, you can keep them mild. If it gets bad, it's something that people can live with for months, if not longer than that. So that's definitely something to listen, and if you're feeling that pain, to just lay off a little bit. Okay, next one we are going to hit is patellofemoral pain syndrome. So this one is known as runner's knee, and the pain generally is on the front of your knee around the kneecap. You may have some swelling, you may feel a little popping or grinding around your knee. It tends to increase when you're running downhill or walking up or down stairs. If you've been sitting too long, if you go down, you're kneeling or squatting, then you have the pain tends to be worse in those situations. Potential causes, again, overuse, repetitive stress. Here, muscular imbalances. So if you have one side that's stronger than the other, or you're more quad dominant, you end up, this is another potential cause or contributing factor. Misaligned bones, so you're just not lining up correctly. And that may be genetic, and it may be due to the muscular, the imbalance, the muscular imbalance. If you have hypermobile feet, flat feet, overpronation, and again, shoes, if you're wearing the wrong type of shoes, or if your shoes have been worn out too much. And same kind of initial treatment, sometimes wrapping, elevating on this one as well. Tendinitis. Oh, sorry, I think I skipped one. Yeah. IT band syndrome. So this is, again, generally felt in the knee, but now it's the outside of the knee. So the IT band is a strong, thick band of fibers that runs from the outside of your thigh, past your knee, to the top of your shin bones. And the problem occurs when the IT band gets too tight and it starts rubbing on the outside of your knee. So you also, in addition to the pain there, you may also experience swelling and tenderness, some warmth, redness. The pain may not be localized in the knee; it may spread up and down the leg and into the hip. The pain, again, is caused by repetitive rubbing of the IT bands. So a key in there is to get out there and keep your stretching and strength training. You often see it in sports that have repetitive bending of the knee, and we hit two of them there for running and cycling are two sports that can contribute to the IT band pain. And since we do both of them, we get double risk factors. So, so potential causes here, training errors. Again, that's the doing too much, too fast, too soon kind of errors. The shoes that you're running in that aren't, if they're not stabilizing you properly. Your running mechanics, running on uneven or banked surfaces. That's a pretty common one around here. Or, you know, depending on where you train, a lot of the roads are banked, and so you're running crooked a lot. Same like if you're doing track workouts with a lot of bends there. But muscular, here's one you can do something about, is the strength in your glutes, hips, abs. Another potential contributing factor is an inward foot or leg rotation. So if your toes are pointed in, and also leg length discrepancies. So that a leg length discrepancy will cause an imbalance there. Initial treatments, same thing, rest, ice, anti-inflammatories. Next one. Okay, so we have a question that's come up here, and it's a question on, can some of these managed or be resolved with strength training technique, recovery, and smart training plan coupled with run form analysis? The answer is yes, yes, and yes. And those are things I'm actually going to go through them at the end of the presentation. So I'm just going to cover the injuries first, and then I will go through all of those at the back end of the presentation. So I'm going to keep running through these. Tendinitis. So tendinitis, another overuse repetitive movement injury. So the tendon is a thick fibrous cord that attaches bone to muscle. So we have tendons all throughout the body. Tendinitis can occur anywhere in any tendon in your body, but where we tend to see them most is your shoulder. So for us, for swimming, in your knee, in your elbow, in your heel, so your Achilles tendon, or in your wrist are the most common places. And symptoms include pain and tenderness, some mild swelling at the site of the joint and the surrounding areas. You might start seeing loss of movement. So like swimmer's shoulder, you tend to see some loss of movement in your shoulder. You might have your knee that's just unable to fully, work when you're trying to pedal your bike. So in this case, the pain often increases with movement. Initial treatment, same as the rest, ice, and anti-inflammatories. Okay, sprains, strains, and tears. So a sprain and a strain are similar in that they're basically, they're stretching and tearing, but the sprain is something that's in your ligament. So the fibrous tissue that connects bone to bone, it tends to happen more like as a sudden thing. So a twisted ankle is an ankle sprain. They're not as common injuries for us, but as you get tired or there's a pothole or something like that, they can definitely happen. Strains or tears are more common. So strains are generally, they're in muscle or tendon. We talk about them most as a muscle strain. A strain and a tear are the same thing, but tend to be, as we think about them, the tear is a more serious, it's on a continuum, so it's on the more serious end of it. It usually occurs as a result of fatigue or overuse. Here are the symptoms: pain, swelling, tenderness. You can have discoloration, redness, potentially cramping or muscle spasms, and the pain often worsens with movement. So Again, muscle strains, they can happen anywhere. For people who've all of a sudden been spending a lot of time using swim tubes, you might be starting to feel some strains in muscles that maybe you're getting a little more focused in now. We see muscle strains a lot in quad muscles. So, but again, they can be anywhere. Usually, if they're minor, some rest and they go away. But if you keep pushing on a strained muscle, you can end up with some significant injury, which will keep you out for a while. Okay, piriformis syndrome. So the piriformis muscle is a pretty small muscle. It runs diagonally from your lower back to the upper surface of your hip. The sciatic nerve runs underneath the piriformis muscle. So piriformis syndrome occurs when the piriformis muscle compresses the sciatic nerve. So it gets inflamed and it presses against the nerve, and that's what causes the pain. So the symptoms here include tenderness, numbness, or tingling in the middle of your buttock area. It may extend down the back of the leg as well. Same initial treatments, rest. In this case, an ice-heat combination is recommended and anti-inflammatories. Okay, low back pain. Just have a couple of these left. So low back pain, here just think I've been in my aero bars for way too long. That's the kind of thing. It just ends up putting a lot of stress on your lower back sometimes. It can also happen with twisting, so you can get lower back pain if your swim technique is off, or even like, you know, from running if you're twisting too much when you run. Posture creep. So this one, as we get tired, maybe that flat back that we had at the beginning of our bike ride isn't so flat by the time we get to the end of the bike ride. Your position. So this is really an important place where a bike fit really comes into play. And one of the big contributors here is just weakness through the core. The only thing that you can counter the strain to support your back is your core. So having a strong core is super important. So on this one, if the pain stays in one place, chances are it's muscular. If it travels around, then it's probably caused by nerves. Okay, rotator cuff injuries. So these can be they're the muscles and tendons that surround your shoulder joint make up your rotator cuff. So these are injuries that I'm talking about separately, but they're really the same kind of, we've talked about these injuries before, tendinitis or muscle strains. And so you'll end up with a dull ache in your shoulder, disturbed sleep sometime, arm weaknesses, loss of motion. And they're often a result of poor body mechanics, so swim technique in our case, maybe an alignment issue, a bone alignment issue, or an overuse injury. Okay, so what causes all of these injuries? Can be a few different things. So biomechanics and imbalances, and we're going to spend some time going through most of these in some detail here. So, sorry here. Okay, so biomechanics and imbalances. The biomechanics can be something that you're born with. It can be structural. It can be muscular. Footwear, again, the right kind of shoe, and replacing your shoes when you need to, particularly your running shoes. Training surfaces, again, this mostly applies to running. Your training, how you actually train, the volume, intensity, and frequency. We'll spend some time with that. Rest and recovery, strength training, nutrition and hydration, and if you are carrying some additional weight, and also sleep and life stress. And all of these can contribute to injury. Okay, next one, biomechanics and imbalance. So this is the first one on the list here. So with foot mechanics, structure and alignment. So you have, as when you go and you're finding a new pair of running shoes, you have to go through the question of, do you pronate? Do you supinate? Pronating is when you're leaning inwards. If your foot position is normal, then it's straight up. Supinating is when you're pushing outwards. Or you're leaning outward, sorry, with your foot. Form and technique, your posture, any skeletal or muscular imbalances. Here we want to look at running form, swim mechanics, bike fit. Okay, so how do you know if you have biomechanical or imbalances here? We have, through QT2 systems, we have a functional assessment. That is one. There's other movement screens. Going to a physical therapist is also a really good place to get assessments done. And I'm not going to spend a whole lot of detail on these. The information is available to you. There's also actual presentation. I'll review some of the presentations are related to this one, but it's basically a series of tests to figure out how well you're moving, how stable you are, and how well you're moving. And in here, we are looking for one of the biggest, we're looking for limiters, but we're also looking for imbalances. If you move differently on your left side versus your right. So if you're doing a squat and your right knee is aligned, but your left knee falls in, or your left foot tilts out. Basically, if you're imbalanced, you are much more likely to end up getting injured than if you're limited consistently side to side. So it's looking for both mobility, stability, limitations, but also balance one side to the other. So, and then doing evaluations. So finding someone that can look at your swim stroke. And a lot of the coaches can do, like if you can't see them live, can do video analysis and just kind of tell you what kind of filming they want you to look at. Getting a really good bike fit. I can't stress how important that is with the amount of time that we do spend on our bikes. It's critical. And then a run gait analysis. That's again something that you can send a video to your coach to look at, or this is something that there are definitely physical therapists that specialize in this that can look at you and looking at your foot position, your body lean, your hip. If your hips are going side to side, if they're rotating, how much they're dropping, what your knee bend is when you land. And those are things that can be looked at, and then corrective drills to be put in place, or corrective strength exercises and stuff like that. So definitely worth getting a look at all this. So footwear, common contributor to injury. So wearing improper or overused shoes. You do not want to overwear your running shoes. I put in a range here of 200 to 400 miles per pair. It may not even be that much. If you're wearing a really lightweight shoe, one that's really flexible, that shoe, you might go through it in 100 miles. So there's no like set exact rule. You need to look at the wear pattern on your shoes. I can tell with mine, like I have an imbalance between my left and my right. I land further out to the side on my left shoe. And the more it gets worn like that, then the worse my foot placement is. So I replace my running shoes as soon as I start seeing like any significant wear. That shoe is gone. And it may not be, though, some of the soles are so super durable, you might not see very much on the sole of your foot. So you're also looking at the inside. Running shoes do not last forever. You want to balance your shoes, run on at least a couple different pairs of shoes, and also replace them pretty regularly. So sometimes, and it also, like breaking in your shoes is important. Some shoes need them more than others. If you've got a super flexible shoe and it's the same shoe that you always run in, chances are you can take them out of the box and do your normal workout. But it's always good to be cautious on there and break in your running shoes. And sometimes shoes are defective more often than would like to think. So you want to also just, if the shoe doesn't feel right, even if it's a pair of shoes that you've always worn, if it doesn't feel right, then maybe try to find another pair of shoes that will work better for you. And the shoe, though, it's also something that when you go to get a pair of running shoes, it helps to go to a really good running store and have them look at you. I know that right now that's maybe not as feasible as it has been in the past, but there are some websites out there that can help you pick running shoes. And if you just kind of include some information about what's going on, that you might be able to get some help trying to pick the right shoe. And if it's not, If the shoe doesn't feel right, as soon as you put it on your foot, it's not a good running shoe for you. So take it off and try on the next one. There is no right brand. There is no right shoe. You have to do what works for you. There's a lot of difference in there. Stability versus neutral shoes, shoes that have a lot of cushion in them, but are stiff versus shoes that are really flexible through the sole. The drop, I mean, you can go anywhere from 0 drop shoes on like the Ultra to like 12% drops. And so it's, again, it's finding the shoe that works for you. Inserts or orthotics, that's something that if you've had injuries in your feet or injuries, if you fall in too much, that's something that might be recommended for you. And now, not running related, but on the bike, your cleat placement can really play into all this as well. If your cleats are pointed out, or if they get loose, or one is further back than the other, those can contribute to injuries. So one webinar I just want to point you to is that there is a webinar on running shoes and how to select them, and that gives some good things to walk through. That's available on the in your member page. Okay, next one. Okay, so training surface. The surface we train on can have an impact. In the perfect world, you can do all your training on nice, soft surface, or really like smooth, flat trail is great. It puts a lot less stress on your body, but that goes, to the opposite extreme is running on sidewalks, which sometimes you're stuck doing, whether you want to or not. So sidewalks, anything that's concrete, is extremely hard, puts more stress on your body. Banking and uneven surfaces. So like I mentioned before, roads can be really uneven, especially in climates that have a lot of runoff or have snow. You tend to see one side of the road more banked than the other as well. And curves. So a track is a super soft surface. It's great, but if you run on a track, you need to try to switch directions so that you're not constantly running around the same curve. And this is aggravated if you're on an indoor track. So, sorry, going backwards here. So yeah, so if you're running on a track, I know a lot of the time you have to go, the tracks have guidance on directions, but even like if you're doing your rest sets or your recoveries in between, you go on the far outside of the track and just try to mix it up a little bit so that you're not constantly going the same direction. If you're running a route, sometimes run it if it's a loop, run it sometimes in one direction, sometimes in the other direction, to try to even it out. If you can pull yourself out more in the middle of the road, if you're in a quiet place, that's going to help. So you want to avoid just running all the time where you're putting your body into an imbalance. And then there's the basic stuff, the cracks and the potholes and hazards that can be out on the road, the silly mistakes there. Steep inclines or declines, we have to race sometimes downhill, but doing speed work downhill is not great for the knees, especially if you don't have really good quad strength. And also if there's just not enough variation, like you do want to mix it up. I live in Florida. I have very little access to trails. I have no access to hills for the most part. So I constantly find myself running on really similar surfaces. And the only way to really mix that up is to get on the treadmill and do some hills there. So I don't like to do it, but I do try to do it to keep things mixed up a little bit. Okay, so training. Here's where it comes in, right? How we train can impact our likelihood of injury. So I'm going to go through some of the do's and the do nots here. So the biggest do is follow your training plan. I think most of you who are on this call are QT2 family athletes here. You have a coach. The coach has put up a training plan for you. It considers your training stress, where you started, where you need to go, what your goals are, what other things are going on in your life. All of that is thought through by your coach. And so the best thing to do is follow the plan as closely as possible. And if you can't follow the plan, if there's something going on, talk to your coach. So don't try to ad lib and change stuff around, but have a communication and have the plan be adjusted so that it does work for you. So we want to progress our training stress. So training stress is a combination of volume and intensity. So if you're just going out and doing long, easy miles, you're getting a lot of volume, but not necessarily intensity. If you're going and you're doing a track workout, you're getting intensity, but not necessarily volume. So training stress is a combination of both. It's and on Training Peaks, it'll actually calculate your training stress, and it'll be the amount of time that you spend relative to your threshold. But it's generally a combination of both. So we want to progress training stress, but we don't want to progress it too quickly. And we'll go over that a little bit more on the next slide. You do include rest days and you do include recovery weeks. When we train, we put a lot of stress on our body. That's how we get stronger, is to add stress. But until we take a step back and we recover and we let those little tears in our muscles heal, and we let the fatigue that we've been accumulating over time resolve itself a little, if we try to train through all of that, that is when you get injured. You need the rest days, you need the recovery weeks. It's just part of it. So going through it in a little more detail. So a lot of the time, like particularly in the running world, you hear the guidance that you shouldn't increase your volume more than 10% per week. And that's a great way to think about it. But that, if you think about it from the training stress concept, that works so long as your intensity isn't changing week to week. So if you're on a beginner marathon training plan and you're not varying your intensity so much, that's great. Increase your volume 10% every week and follow that guidance. Take your recovery weeks and you'll be in good shape. We have our training plans tend to be a little more complex than that. So the factors that the coach will work on with you is to start where you are. So if you've never trained before, you're starting at a different place than if you're a 10-year Ironman athlete. Year to year, not to increase volume more than 15% from the year prior on sustainable weeks. And then within any given training, so you start with your base phase, which tends to be the phase where you're getting in your Z1 work, where you're building your aerobic foundation. On here, we have our general progression week to week in that 10% range, and then the recovery week. This next base phase starts at the volume that the last one left off. So base 2 starts at the volume from base 1 and goes from there. Once we go into your build, at this point, now you're starting to add intensity. So you've increased your training stress. So in general, the first build will have the same volume or the same amount of time as the last base block. So that's the guidance. And then when you progress within the build phases, your first week of build will be the same training stress volume as your second week of the week prior. So you don't start where you left off, but you start 1 week back, but then you build higher. So that's the difference with that. Okay, next one. So some other do's and don'ts as you go along. Do include a warm-up. Too often, I think people are pretty good about warm-ups in the pool. You get in, you've got your warm-up, your easy swims, your some kicks, some pull maybe, your drills. People follow that pretty well in the pool. On the bike, I think, unless you're off in a group that's going like gangbusters from the start, people are pretty good about warming up on the bike, taking it easy for this 10 minutes. The run, on the other hand, tends to be different. People just start running. They're like, okay, let's go. And then, just kick into your Z1. But warming up is really important. So I like to include in the warm-ups a walk, dynamic warm-up exercises. And dynamic warm-up exercises are functional movements that are similar in the same movement patterns and use the similar muscles to what you're about to do, but they're less intense. And so it's just a way to increase the blood flow to the muscles, raise your core body temperature, increase your heart rate, activate the central nervous system. They're also a great mental way to get into your workout. And you just then, when you go to take that first step running, it feels good. That's the point of doing the dynamic warm-ups. And If you're doing a harder set like a track workout, then adding in drills and doing some easy running before you go and you hit it makes sense. And that counts too when you get to a race. So for all the warming up that you do in training, also have a race day warm-up plan too. And then cooling down after. When you finish, you should not just finish hard and like be like, oh, okay, I'm done now. You know, take it down, let your heart rate come down, do some stretching after. Static stretches after exercise is great, regaining flexibility and range of motion at that point. Stretching also as a stand-alone workout is good too. Just warm up your muscles before you start stretching them a little bit. So ease into it. If you're going to do stretching as its own workout, ease into it. Do some dynamic work first before you do some static stretches. And do include strength training. And I am going to spend some time talking about the QT2 strength training protocol here, and also body maintenance stuff. I mentioned stretching, foam rolling, massage, and then one of the first points I started with is that if pain exceeds 3 out of 10 or your mechanics are altered, stop. Stop, pause, take a step back. Don't push through it. If you push through it, instead of being out a week, you could be out 2 months. And that's definitely not something that anyone wants to do. So on the flip side of all of this, some common training mistakes: adding volume. So either to a training session you're doing, if it says to do a bike ride for an hour and a half and you go out for 2.5 hours, that's not really what was intended. Or you just add a training session. You're just like, oh, I got some extra time, so I'm going to throw in another training session. That's one common mistake. Adding intensity. It says that you're supposed to run Z1. You're like, yeah, I feel great today, so I'm going to go out and do a tempo run. That's another common training mistake that see more often than I would like to see. Skipping workouts and then trying to make them up. If you miss a workout, in general, the best thing to do is just say, I missed the workout, and move on. If you start missing a bunch of workouts, and that's a different deal, and that's a conversation that will require an adjustment to your training schedule. Another common mistake is not taking rest days, or at least if not pure rest, like active recovery days. Some people feel better if they go for an easy walk or a super easy spin, or just spend time stretching rather than taking complete rest. But you need a day where you are pulling back on that training stress, not adding to it. Other common mistakes: not warming up, not cooling down, training when you're sick or tired or under significant life stress, which a lot of us are under more of now. We have one stress bucket, and training is just one of the things that goes in it. Don't underestimate what all of life stress can do to put your body, make your body more compromised. So another one is trying to complete a workout your body's not prepared for. This may be because you're really tired, you're overly fatigued, but if you go out and you have a really hard tempo, you've got a tempo run where you're doing stuff, upper end of Z3, 10K pace work, and you are tired, and you try to do that workout, you're going to be more likely to get injured from it. Or if you're newer to training, or if you've taken some time off and tried to do a hard workout, then you do it at your peril for sure. Not hydrating and fueling properly, and not listening to your body screaming to you. Okay, so strength training. And this is, there's guidance that we have about when to do strength. The answer is if the question is, should I do strength? The answer is yes. If the question is what kind of strength I should do, there's a few options in here. So core and prehab work is basically the work. So anytime you have an opportunity that you can add in core, anytime during the season, it's a good thing to do. So we're talking not just your abs, but your hips and glutes in that area. To getting stability through that core area is extremely important. So that way, as you start getting fatigued, you're more likely to be able to hold your technique for longer if you're stronger through your core. Then the adaptation phase. So this is done early in the season for a couple weeks, and it's really light strength work. It's just to get you ready for what's to come. And then the max strength phase, which is done for about 6 weeks. Functional compound exercises to build strength. They're higher in weight, lower in reps. That gets followed by sport-specific exercises, some more movement, the movement patterns are more similar to our sports. TRX training is used to maintain the sport-specific strength. It's great body weight functional movements. Plyometrics can be added. I am not going to spend time going into the details of strength training. Jackie Miller did a great presentation that's up on the member site, which is strength training, that extra 1%. And in that, she goes through a lot of detail about what I just talked about here, as well as so the specific exercises that you do and some guidance in terms of technique and how much you should be doing of them. Okay, so nutrition and hydration. I'm going to say here that it's really important, but I'm not going to get into it in detail. Core Diet has a lot of services for race day fueling and for general nutrition planning, but you need to fuel your body when you train. You need to fuel your body when you're not training. How you fuel it is different though. To stay hydrated, what kind of supplements, stress factors, again, I mentioned before, from if you don't have a right nutritional balance, that is definitely a contributor. So we want to, how we eat impacts how we feel, how we perform, and how likely we are to get injured. So there are a lot of webinars and information on Core Diet on nutrition hydration. So I'm just gonna go through that. So you're hurt. What do you do now? So first line treatment, we went over these really on the slides. And the first thing to do, you just rest. So complete rest or rest from the activities causing the pain. At the beginning, recovering takes a lot of energy. So right at the beginning, taking complete rest is sometimes just what you need to do. But then you can get back into it. So if your shoulder's bothering you, well, you can still probably ride your bike, at least on the trainer. If your knee's bothering you, then you can still swim. If you've got a stress fracture in your foot, you may be fine riding your bike with a stiff soled shoe. You may be fine swimming. You may be fine pool running. So once you give yourself the rest, then it's a question of what am I able to do that doesn't cause me pain? And those are the activities that you can pursue. Ice. Ice is you just ice until the inflammation stops. It's not a continuous forever treatment here. 3 times a day for 20 minutes to reduce the acute inflammation, elevation and compression, and then the anti-inflammatories. So after that, if you've gone on, it's 5 to 7 days, or if you have a break, or that the injury is serious right from the start, first thing you generally do is go to your general practitioner, and they may refer you on to sports medicine, a podiatrist, orthopedic surgeon, or to physical therapy. So, but your physician is your first touching point to go to. Also, if you can't race, your GP can write you a nice note that says you can't race, and you can get your insurance back from that. I've had to do that before. So first thing though, go to your physician, let them know what's going on, and they can hopefully steer you in the right direction. Physical therapist is probably where you'll end up. For most injuries, you end up as a physical therapist working on strengthening and corrective exercises and stretches, and also potentially there where you're doing biomechanical assessments, gait analysis, and making any adjustments, potentially a chiropractor. So if sometimes our injuries are due to an imbalance that can be corrected with an adjustment. So having a chiropractor on your team is a good option. And then massage therapy and acupuncture are 2 other potential injuries. So injury prevention tools that you have. Okay, so what's next? The road back from injury. Injuries don't last forever. As I hope you've gotten now, though, that there's ways that we can maybe minimize the injury. So where the break is a week or 2 weeks. But if you're not listening and you've pushed too far, or it's something that just happened suddenly and you're out for a while, how do you come back? So first rule is don't come back until you're ready. coming back at 70% or 80% or even 90% can just set you back even further. And I know it's really hard to wait sometimes, but if you rush coming into it, then you're going to take a step back and be out for longer. Once you do come back, take it slow, really ease into it. Don't go pick up where you left off. Step it back, and this is something that your coach will work with you on. And then focus on what you can do. I talked about before, just because you're injured in one place doesn't mean that you have to do nothing. There are lots of other options you can continue to keep your fitness up, so that when you are ready to go, you'll be able to hit the ground running and go, easing into it. Corrective exercises, strength training, stretching, trying to do the things that maybe you didn't do before you were injured in the first place. So getting yourself back, and then, continuing to do it after, because now you're back, you're healthy, but you want to stay healthy. So trying to incorporate that into your routine, and then some adjustments to your mechanics or your equipment. I mean, this is if you need to adjust your bike fit, get it done. And if you've done a run or swim analysis and there's been identified weaknesses and there are things that you can work on, this is time to work on adjusting those. We have a run injury, return to run protocol. So first thing, remain as active as your injury allows. Then your run volume basically gets split up between additional cycling volume and a substitute for running, like deep water running or power cranks on the bike. But pool running it's great. I shouldn't say it's great. It can be really boring, admittedly, but it's the closest thing to running that you can do. And so it has all the benefits, plus you have the resistance of the pool. It's something that you can do with a stress fracture once you get your physician to sign off on, but it's a really good way to be able to keep your running mechanics going without putting the stress on your body. And you can get your heart rate up and get working. I did a presentation last year on pool running, and it's up in the member area site, and that can go into all the details on that. Some other options, if you have access to them, is an AlterG treadmill, which is something that basically takes some of your body weight, so you're only carrying some. And then the light speed lift, which works with your own treadmill, and it's just a contraption that goes around your treadmill that lifts your body up. So it's the same concept as the AlterG, but it's something that you can add separately to your own treadmill. And also consider a walk to run approach. So when you get back into it, taking it slow, you can go in. You don't have to immediately say, well, let me run a mile and see how it feels. You can say, well, I'm going to walk for 5 minutes. And then for the next 10 minutes, I'm going to alternate a minute walk, a minute jog, and see how I feel. And but as you're coming back, if you're having pain, stop. My rule on injury is before you stop, you can go to a threshold of 3. When you're coming back, if you are not sure, if you are questioning yourself in any way, whether it's something that you should be doing, you shouldn't be doing it. Take a step back, give yourself a couple more days, try again when you're ready to go. Okay, so I mentioned before that there's a lot, the content in here overlaps content that's in a lot of other webinars. So I was short in some of those areas. I didn't go into detail. So here's a list of the webinars. Some of the webinars are in the member area page in your various coaching area that are all about, that may be useful if you want to go back, if there's something that's specific that you want to look at. So, so I'll just point you in that direction. And then I'm going to take any questions, except that I'm just going to see if I can end this because I'm having, there we go. Okay, so. Okay, so this was a question from earlier on about alternating shoes. Yes, I think it's a good idea to alternate shoes. That can either be 2 of the same shoe, or like for running, you might want to use a different shoe for your long run versus your speed work. But yes, I would, because it takes time for the insole of the shoe to bounce back in between runs. So I would on running shoes. Rest. Another question about rest from a mental perspective. I think that's also very important. A couple times a year. I first started racing, geez, how long ago? About 20 years ago, I guess. And for some period of that, I raced my bike. And there were literally times where the season was done and you just hung up that bike and you didn't look at it for 2 months. It's something that you don't see as much now, but you just need the break. I mean, mentally, you need the break. So within any season, after big races, it's really tough to go from a big race, be like, okay, I'm going to keep on training. You are mentally, you put so much into it and getting ready for something, you need to take a break. So I would say that rest is extremely important mentally. And along the same lines, would you recommend other activities for a mental break? Yeah, I think that's another one. I think, like going on hikes is nice in the wintertime. If you live in a snowy area, there's options that you can do other than run. Like cross-country skiing or snowshoeing are some good options. Just the one thing I will be cautious about this is that I wouldn't recommend sports like basketball or soccer or things that have sudden changes, or maybe not the best time to pick up golfing or a new sport, because the movement is so different than what we're used to. But that's always something that you have to take in, because it's fun. But I've seen people lose their seasons because they decided they were going to do a pickup basketball game and hadn't played for a while. So, does anyone have any other questions? I'm happy to answer anything that you might have now. And if not, feel free to reach out anytime. And I hope that I gave you some more information to just start listening to your body and, take some control over that. And I guess with that, I will wrap it up for the evening. But and please reach out if you have any questions. And thank you for attending tonight. And this webinar will be available for you in the future. Thank you.